Hello, my name is Rubén Palacios, and today we'll be talking about origins of cystic fibrosis lung disease. That definition. Cystic fibrosis is an inherited disorder that causes severe damage to the lungs, digestive system, and other organs in the body. It affects the cells that produce mucus, sweat, and digestive juices. These secreted fluids are normally thin and spirally, but in people with CF, a detective gel causes the secretions to become sticky and thick. Instead of acting as lubricants, the secretions split out the tubes, ducts, and paceway, especially in the lungs and pancreas. Also, cystic fibrosis is progressive and requires daily care. People with this issue are usually able to attend school and work. The origin: this is a hereditary disease. It is caused by a defective gene that leads the body to produce an abnormally thick, unsticky fluid called mucus. This mucus collects in the airways of the lungs and pancreas. This bulk fluid of mucus causes life-threatening lung infections and serious digestive problems. This disease can also affect the sweat glands and the male reproductive system. Many people carry the CF gene but does not have any symptoms. This is because a person with this disease must inherit two defective genes, one from each parent. Some Americans have the gene. For CF, the disease is more common among people of Northern and Central European descent.
Digestive and respiratory systems, and some other organs in the body. Cystic fibrosis affects the cells that produce sweat, mucus, and digestive enzymes. Cystic fibrosis is characterized by abnormal secretions, leading to a buildup of thick, sticky mucus that damages the organs. Normally, these secreted fluids, or mucus, are thin and slippery and lubricate the lining of various organs and tissues, preventing them from drying out or getting infected. However, in people with cystic fibrosis, the fluids become thick and sticky and may clog the tubes, ducts, and passageway in the body, leading to serious, life-threatening problems. It may build up in the lungs and block the airways. This makes it easy for bacteria to grow and may lead to lung infections. With time, infections can severely damage the lung. The fluid can also block tubes in the pancreas. This may hinder the digestive enzymes that allow the body to break down food and absorb vital nutrients from reaching the small intestine. This can cause malnutrition and vitamin deficiency. Your sweat can also become very salty. Thus, a large amount of salt is lost when you sweat. This can upset the mineral balance in your blood and may result in serious health conditions, such as dehydration, decreased blood pressure, stroke, and rarely, death. Cystic fibrosis affects mostly the lungs, pancreas, liver, intestines, but also the kidney and the sex organs. Cystic fibrosis also causes infertility in both men and women. Although people living with the disorder require daily care, they can still have a normal life and work or attend school. Cystic fibrosis is most common among white people of Northern European ancestry and least common among Africans and Asians. About 1,000 new cases of the disorder are diagnosed each year. It is the most common inherited disease among white people. Causes. Cystic fibrosis is caused by a defect in the cystic fibrosis transmembrane conductance regulator gene, or CFTR gene, which is located on chromosome 7. This gene makes a protein that regulates the movement of water and salt in and out of the body. Every individual inherits two CFTR genes, one from each parent. In order to have cystic fibrosis, a child must inherit a faulty gene from each parent. Children who inherit one normal gene and one faulty gene will be a carrier of the defective gene and may usually not develop cystic fibrosis. However, they may pass the defective gene on to their own children. Symptoms. Symptoms may vary depending on the severity and may include respiratory symptoms. If the mucus clogs the airways, it can cause symptoms such as wheezing, breathlessness, a persistent cough that produces thick mucus, inflamed nasal passages, or stuffy nose. Digestive symptoms. If the mucus clogs the tubes in the pancreas, symptoms may include severe constipation, foul smelling, greasy stools, poor weight gain and growth, especially in children, intestinal blockages, particularly in newborns.
Applications in medicine. This type and severity of CA symptom can differ widely from person to person. Therefore, also the treatment plans can contain many of the same elements. They are tailored to each individual's unique circumstances. The type and severity of CF symptoms can differ widely from person to person. Therefore, also the treatment plans can contain many of the same elements. Therapy. People with CF complete a combination of the following therapies: airway clearance to help loosen and get rid of the thick mucus that can block the lungs, inhaled medicines to open the airways or thin mucus, T. Pancreatic enzyme supplement capsules to improve the absorption of vital nutrients, and individualized fitness plans to help improve energy, lung function, and overall health. CFTR modulators to target the underlying defect in the CFTR protein. Medications. The options include medications that target gene mutations related to the disease, antibiotics to treat and prevent lung infections, anti-inflammatory medications, mucus cleaning drugs, inhaled medications, oral pancreatic enzymes, and stool softener to prevent constipation or bowel obstruction.
Cystic fibrosis, or CF, is a genetic disease that affects multiple organs, including your lungs, and limits your ability to breathe over time. Your main airway, called the trachea, branches into each of your lungs. The largest airway within each lung is called a bronchus, and each bronchus branches into smaller airways called bronchioles. Normally, airways are coated inside with a thin layer of fluid and mucus. The mucus catches dust and germs from the air you breathe in. Then, hair-like projections on the airway surface, called cilia, push the mucus, trap dust, and germs out of the lungs. In cystic fibrosis, the mucus is so thick and sticky that the cilia can't push it out of your lungs. This thick, sticky mucus can build up, trap germs like bacteria, and block your airways. Because of this, you may periodically have acute infections or exacerbations of the disease, causing symptoms such as increased coughing, production of mucus, and shortness of breath. As the disease progresses, long-term damage can occur in your lungs. This happens when germs, like bacteria, get into your lungs and cause chronic infections and inflammation. But there's a lot you can do to control the infections and slow the progression of lung damage. Talk to your CF care team about how the different parts of your treatment plan can help keep you healthier. As
Pros and cons. Pros. There is no cure for cystic fibrosis, but the treatment can ease symptoms, reduce complications, and improve quality of life. Close monitoring and early aggressive intervention is recommended to stop the progression of CF, which can lead to a longer life. Managing cystic fibrosis is complex, so consider getting treatment at a center with doctors and medical professions trained in CF to evaluate and treat your condition. The goals of the treatment include include preventing and controlling infections that occur in the lungs, removing and loosening mucus from the lungs, treating and preventing intestinal blockage, and providing an adequate nutrition. Cons, complications. The damage of the airways, like chronic lung conditions with abnormal widening and scarring of the airways, chronic infections, growths in the nose, cough out blood, pneumothorax, respiratory failure, and acute exacerbations.
People living with pulmonary fibrosis often experience confusion and frustration as they try to understand their diagnosis. Pulmonary fibrosis is a complicated diagnosis that encompasses many diseases. The big picture of lung disease is vast and includes diagnoses such as COPD, asthma, and cystic fibrosis. In addition, we have a family of diseases called ILD, or interstitial lung diseases. Now, there are over 100 different kinds of interstitial lung diseases. We group these diseases together because they share two common features. One is inflammation, and the other is scar tissue. These both occur in the walls of the tiny air sacs of the lungs. Your lung is made up of millions of tiny air sacs, too small to see without a microscope. The wall of each air sac is very thin, about 10 times thinner than a strand of hair. These walls need to be thin to allow oxygen inside the air sac to move easily through the wall into the bloodstream. It's easy to take a breath as thin walls mean that the lung is flexible, and therefore easy to expand when you breathe. When scar tissue or inflammation builds up in the walls of the air sacs, the wall gets thicker, making it more difficult for oxygen to get into the bloodstream. Thickened walls are also stiff, making it harder to breathe, which causes breathlessness. Scar tissue and inflammation can also trigger cough. So what is the difference between interstitial lung disease and pulmonary fibrosis? Interstitial lung diseases include all of the diseases in which there is inflammation or scar tissue in the walls of the air sacs. Many forms of interstitial lung disease can also be called pulmonary fibrosis. Pulmonary fibrosis, however, is not a specific disease. It is a general term that refers to any kind of ILD in which scar tissue is present in the walls of the air sacs. Your doctor will work with you to figure out which kind of ILD you have.
Issue applied in Ecuador. Professionals with treatment who treat CF have considered that in the country the diagnosis is late, in spite of being the most frequent of the rare disease and being the Ecuadorian supersess and a specific type of mutation. In our country, the diagnosis is made by the symptoms and the could be at 3 years, it is late. It must be adverse and the prognosis improve a lot because of measures are taken immediately. According to two specialists, the sweet and this and the genetic study are the diagnostic options. However, neonatal screening is the most effective and efficient alternative for capturing patients with this pathology, since it is the most frequent among the rare wards, because with a better prognosis than the others, with adequate treatment. The incidence in Ecuador is one case in 11,000 six live births. On although CF exists throughout Latin America, it was reported in Spain that the H609R mutation is specific to Ecuadorians. Some specialists have suggested to the health personnel to think about differential diagnosis in children with recurrent respiratory disease and who do not gain weight. We must think about CF and do everything possible to do the sweet test.
Your lungs have a pretty important function. They inhale air, passing oxygen into the bloodstream, where cells use it to produce energy. The energy makes carbon dioxide, which the bloodstream carries back to the lungs, allowing you to breathe it out. Air moves around your lungs through thousands of little airways. You have almost 15,000 miles of airways in your body. That's like flying from London to New York and back twice. At the end of these tubes are teeny balloon-like structures called alveoli, which pick up the oxygen and drop off the carbon dioxide. Inside your airways, a thin layer of mucus catches anything you breathe in, like bacteria or dust. Your airways are also covered in teeny finger-like structures called cilia, which move backwards and forwards to push the mucus and everything it contains out of the lungs. In people with cystic fibrosis, this mucus is stickier than it should be, so the cilia don't always work properly, meaning bacteria can become trapped in the lungs, causing infections.
Conclusion: the CEF is a rare genetic disease, but is one of the most common in the population. Since it is hereditary, its diagnosis must be made in children. An early and timely diagnosis should be prioritized, which, with proper treatment, can improve the prognosis of life for patients. Unfortunately, in our country, the difficult economic situation worsened by the pandemic has made it difficult to import the necessary drugs for the treatment of this disease. It is important to inform our communities about this disease in order to prevent future complications. Thank you.